The next question is for Captain Zell. And the question is, what's the deal with the people that had bad reactions to the vaccine? How common is that, and why did that happen?
Great question, Captain Pytlik. Thanks for asking. I think as a whole, it's important to remember the difference between an adverse event and a side effect. We expect side effects with vaccines. We're getting the immune system to respond. We're expecting site soreness. We're putting a needle in somebody's arm. So the side effects are expected. Fatigue, site soreness, maybe some body aches. Those things are what we expect with any vaccine as the body responds to what we're trying to get it to respond to. Adverse events have been relatively few and far between. I think right now in the U.S. we're right above 2.59 million first-time doses, and we count the first time, not the second time, because the first is much more common at this point. And the number of adverse effects have been extremely low. I've had some soldiers ask me about Bell's palsy. There's been some media reports about Bell's palsy in the testing groups for both vaccines. I think there were 7 cases between both the Pfizer and the Moderna trials. And the thing to remember is that Bell's palsy can be caused by a number of different factors, and the rate for Bell's palsy in those groups was still lower than the rate seen in the general public. So what we're seeing a lot of is overall reports on the negative things that happen, much like Sergeant Major Trouerntrend mentioned. Some of those things are a little bit more sensational, and we're not hearing all the positive and relatively unaffected people who get the vaccine and move on and don't experience significant side effects. So the big takeaway here is we expect some side effects. The adverse events have been relatively low and very few and far between. And some people who have had previous anaphylactic reactions to vaccines should be counseled appropriately for the risk of some sort of reaction with this vaccine. But for the most part, there's been very few adverse events with the expected side effects.
So before I let you go on that topic, you talked about how important it is to have a conversation and that counseling with the provider before getting administered the vaccine. Are we providing that opportunity to people before they get vaccinated?
Sure. So anybody with a history of a previous response to a vaccine, there will be providers on site, several. And Colonel Desena can add in with how many specifically to answer questions and provide counseling and address specific questions from soldiers for any concerns.
Perfect. Thank you very much.
And, if I may, just on that, just so the group knows, through a FRAGO, part of the requirements is filling out what we call the Department of Health Agency COVID-19 vaccine screening and immunization documentation. So it walks the patient, you guys, the soldier, through some of the screenings, such as would you like to speak with a healthcare team member about getting the vaccine? And you could say, yes, I request to be screened, and continue on with your, or I do not wish to be screened. I do not request to get immunized. I wish to request to speak to a healthcare provider. So at our vaccination events here in Connecticut Guard, we purposely made it a planning that we will have mid-level providers, meaning a nurse practitioner, a physician assistant, and physicians available to have one-on-one private conversations with any of your concerns. So in order to expedite and increase throughput, we're asking you to start filling out that form early, get it through your unit, and on page 2 of that form, there's a very well-established patient education that talks about some of these side effects, some of these questions that most people have. We've also developed a 1-800 number where we will have providers on call to take some of your questions personally. You also have a Moderna fact sheet where you could call a contact number from Moderna. And lastly, on page 2 of that DHA 207 is a 1-800 number for the Department of Health agency where you could ask those questions anonymously to somebody on the other line. So I hope that added a little bit more operational piece to that. Over.
And if I could add a personal note to that, as physicians and medical providers, it's our role to just be available to have some of these counseling sessions. And if any of us, I'm sure can help in that, that's what we're here for. And that's our duty to do that. And we do it, anytime. So feel free to bring your concerns forward because we'd love to get those out in the open and address them.
Perfect. Thank you, sir.